Happy New Year, little bunny. All right, it is January 2nd. It is Thursday morning. We are here at Bayview, and our first appointment of the morning was dropped off as an emergency. And we have here a rabbit with vestibular disease. You don't get a chance to get these very often, but you can actually see lateral nystagmus right there. Wow. So, inner ear infections, otitis interna is quite common in rabbits, or I don't want to say real common, but having really long ears, I guess, can cause for several infections, and having a eustachian tube that's inside of a mouth that basically is an obligate nose breather also makes it to where there's a lot of bacteria that can stay inside there and make its way into the eustachian tube, and then from there cause inner ear infection. So anyway, this is it's a species that it can happen quite commonly. The bad news is right now the vestibular apparatus is probably infected and got a lot of inflammation, which makes this guy just, do this little tilt thing. So I'm going to run and get some antibiotics, get him in the system, and hopefully it'll start to make an improvement before the end of the day. Anyway, it's way too common. Poor guy. That's like having a drunk on for a while. Bed spins for you college students and adults that remember those.
Yeah. The worst.
Imagine having bed spins 24/7. All right, okay. That could be rough.
It is rough.
Dude, tequila gets me every time. It is still Thursday morning. We're at Bayview, January 2nd. Rabbit that had the nystagmus after getting a shot of corticosteroid and antibiotic. We are already feeling it getting a whole lot better. And it's kind of weird watching the antibiotic shot work, because she was on her side for a minute going, oh my God, I can't take it. But she's doing awesome now. Anyway, so like I always tell my clients when it comes to these patients, I never really can guarantee 100% comeback when it comes to rabbits alone, but this one looks really promising. Okay, so this is an inner ear infection, otitis interna, causes vestibular disease and nystagmus, and so far so good. Matter of fact, let's get a look into this eye real quick, and no sign of nystagmus whatsoever. And for those people who have the crooked head rabbits, it's because you didn't bring them in fast enough. Those shoes did awesome. All right, that's it for rabbit. Till next time, we'll recheck her next week. If you're not having